Hello, I'm Dr. Lizzie Sobel. I'm a perinatal and pediatric chiropractor based in Needham, Mass. And this video, I'm going to be talking a little bit about and showing some ways that you can help massage and exercise your baby's mouth. This is a wonderful skill to incorporate. It's especially important if you are working with any kind of latching struggle, either on the bottle or the breast, in preparation for a potential lip or tongue tie procedure, following up from a lip or tongue tie procedure, or just trying to loosen and relax your baby's jaw and mouth so that they can get the most effective latch possible. I am going to be showing you this on a video on this baby here. So I always like putting on gloves, which is your choice as that parent. Just make sure you have clean hands, obviously. I start by kind of massaging on the outside of their cheeks and jaw, and then gently touching the bit of their chin. That helps engage that tongue to stick out. I'm also kind of inviting my hands inside the baby's mouth. Now, in this, I'm bringing my finger on one side of his gum and then tracing over to the other side of the gum. Ideally, his tongue motion will be following my finger and touching each side that you are sweeping it on. You can do that a few times back and forth. Now I'm going to use the tip of the finger pad of my finger against his hard palate and letting him suck a little bit. Some babies have a really hypersensitive gag reflex, especially if there's oral restrictions. So sometimes they may gag. I'm now taking my finger all the way outside of his lips. So in between the lips and the gum line, just stroking along that area, getting blood flow and getting some and breaking up the tissue there a little bit. Whenever they need a little break, I love just giving them a little spot to suck. Now I'm going to take two fingers along the upper lip and just pulling it up towards the nose. I also like doing these little circles right around the middle of the lip, especially if there was a lip tie or a lot of tension there. And again, I'm just going to let him suck on my finger with my finger pad up. Eventually, I'm going to flip my finger opposite. And so my finger pad is now down. And I want to feel that baby curl his tongue around my finger. So I'm kind of pushing down on the middle of the middle of his tongue and letting that tongue curl around it. Giving him a little more. Now I'm giving it one more sweep under the tongue on one side and under the tongue on the other, stroking up, thinking about bringing that tissue underneath the tongue up away from the floor of the mouth, always ending with a good suck, giving a little tug of war, kind of pulling out my finger a little bit and letting him re-engage and ideally pulling my finger back in. It takes some practice, both on your part and the baby's part.